If you or one of your loved ones are having a hard time putting down that tablet or gaming console after 30 or 60 minutes, if you're getting irritated when the power runs out or when someone's asking you a question in the middle of your favorite game, then you, my friend, might have a video game addiction. Hey guys, this is Dr. Tom Moorcroft and welcome to the Lyme Insider. Today we are diving into this area of the digital world that a lot of people kind of sense in their heart, but they might not know that much about. So while we're usually upgrading your Lyme and chronic illness knowledge, today we're going to be increasing your gaming knowledge. So really today I'm joined by an amazing person, Dr. Koichi Tanji, who is a naturopathic physician and an addiction specialist. Dr. Tanji came to the United States from Japan in order to become a professional boxer. And when one of these ringside physicians said to him, man, you've got the heart and the brains of a physician, you should become an autism doctor because these kids are in great need. And that's exactly what Dr. Tanji did. And along the way, he started to do a lot of research and a lot of clinical work in the areas of addiction, especially in drug and alcohol addiction. And so much of this started to overlap with what he started to see in his medical practice, where over the years, like even pre-pandemic, we saw more and more screen time, more and more kids being sucked into social media, sucked into video games. And then during the pandemic, it skyrocketed. Unfortunately, afterwards, it hasn't come back down to normal. So that's when I was actually in March 2024, I was running the Innovations in Integrative Pediatrics track for the Medical Association of Pediatric Special Needs Autism Conference. And I heard Dr. Tanji speak. And I knew immediately that we needed to go right aside, sit down in the hallway, believe it or not, and do this interview because I needed to get his information and his heart and his knowledge in front of you as soon as humanly possible. So please forgive a little bit of the audio. And they started halfway through setting up lunch and smashing all the silverware in the background, but we just kept on going because this was just such an important conversation to have. So Dr. Tanji, throughout all of his work, has become an expert in video game psychology and also in treating humans from the heart. And what we're going to dive into is what are the signs and symptoms to look for someone who may be having this go from a fun, entertaining pastime into, more of an actual addictive type of thing, because both happen. And also we're going to be talking about what's going on. Can we use this technology to enhance our lives, to help us stay on track, to help us with school, to help with learning, and even at times, to chill out and have a bit of an oasis in the middle of a busy day, and for entertainment in an appropriate way. And how do we stay on that side rather than going over to maybe this video gaming addiction? This has become such a big issue that it is actually going to be an actual diagnostic code in the upcoming revision of our medical diagnostic manual. So this thing is, we have an ICD-10 now, we've got ICD-11 coming out, and in that, you're gonna see that video game addiction is going to be in the same place as drug addiction, depression, anxiety, Lyme disease, high blood pressure, and the like, diabetes. So this is one of those things that's so important to know about. And with knowledge comes power. If you know that this is a thing, we know how to go through it. And what's really cool is Dr. Tanji is going to talk to us about not only identification, but we're going to be talking about how to treat people who are having this condition and what happens when you're the patient. How does the patient actually feel as they go through this, at the beginning, in the middle, and at the end, and how a variety of different patients have gone through sort of the detoxification process, if you will, and then re-entering, having a great relationship with technology rather than having it become an addictive thing. So really, I'm so excited for this conversation today. This is one of the ones where as soon as I heard Koichi speaking, I knew that his message needed to get out there. It's full of knowledge and wisdom based on medical science, a lot of addiction and therapy work that he's trained in, and then his clinical work of putting all this together. But most importantly, he knows what it looks like in people who have pure gaming addiction versus people with gaming addiction as part of their life while they also have chronic illness. So he's got a huge heart and a huge mind, and enjoy this episode.
Colleague, friend of mine, just met him actually yesterday. And the reason that I really asked you to come here and be part of this podcast is your message just blew me away. So I really want to just dive into it a little bit. And so maybe you can tell us a little bit about, you really presented about virtual autism versus regular autism, and then also just this gaming addiction and the screen time addiction. As a father of a 14-year-old who does a pretty darn good job of interacting with her tech, but I feel challenges because as a parent, we're trying to keep her away from all the social or at least having enough exposure that she can be part of it and know how to live in the world, but not be like overwhelmed by it. So it's just, that's why I really wanted to have you here. So I'm so thankful. And maybe you can tell us a little bit about like kind of your background and how you came to this, and then we can kind of dive into some of the details.
Sure. Thank you for having me. I'm a mouth doctor, and came to this field, as you know, a little bit interesting way. I was working as came to the United States as a boxer. And then I saw a transformation of the kids through boxing, and then get into more science part of how these things happen. And then one doc introduced me to the concept of functional medicine and math. So I decided to become a naturopathic doctor. And also I'm a licensed mental health counselor.
Okay.
So in the context of like gaming disorder or negative impact from the screen use, I learned through a place called Restart Life, which is the first United States residential care for gaming addiction.
Wow.
Yeah. That's where I did the internship, and then I worked as a counselor there.
Great. And so what were you seeing? 'Cause like, I have so many people who are like, I wish there was a residential place to go for this or that or that. What got people into there? Like, what would kind of qualify one to go to this residential place?
Right. It's usually sad, complex case. For example, like did therapy, did psychiatry, nothing helped. Kids usually stop going to school, give up in life, and then whatever the response, it didn't respond to treatment usually.
Okay.
And usually stay in the room, wake up in the night, playing games, sleep during the day, and it's very moody, extremely violent can be, and sometimes really aggressive, self and others.
But I heard it was very interesting when I heard you talk about how people can become so violent, and like all these people are like, oh, my kid is locked in their room, but they're just up all night because of their Lyme disease or their mold exposure. And I'm like, no, they're up all night playing games. So maybe we can highlight those symptoms again. I think it's really important for people to hear this. And like, I actually want to go over these symptoms like 180 billion times because it's so important for everyone to hear this. But yeah, so if someone is maybe developing a gaming addiction, what does it look like for the family?
Right. So again, usually they stop performing well in the school or work, could be, and the usually interesting part, poor hygiene. A lot of people, once they get more escalated into actual food addiction thing, they stop taking showers, stop brushing teeth, and then eating habits get even worse. Usually they have picky eating behavior tendency, like getting really, really extreme. Okay. And very moody, it's just lose the coping skills. That's the main symptoms. Just little thing, throw them off, and they get really angry. And then lose the interest from other activities which they used to enjoy. So often misdiagnosed, or it is a symptom, depression. Often people diagnosed as depression. However, yes, it's depression, it's not wrong, but it's just overarching umbrella of gaming addiction.
Interesting. And you had mentioned like children will spend, I think it was you who mentioned, like children will spend so much time on like a book or drawing or something toy that they love. But then there's a period of time where either they'll share it with you or they'll disengage from it. Can you compare and contrast that kind of with this gaming addiction?
Sure. So first, my main message to any parents is gaming is not a toy. Okay, they're an experiment. Kids, a toddler experiment that they don't play any longer than 30 minutes. That's the maximum time that they can play with one toy, half an hour. Right, so that's an experiment. But when you give the screen to a toddler, they can go easily beyond 30 minutes. They can easily go hours. And then at the end, when staff member asks, can you share that favorite toy? They usually let them borrow. However, when it comes to screen, they hold on to it, hide it, say no. Right? Yeah. So this is the main message. It's not under a toy category. It's a substance, actually. It's a stimulus category that is heavily addictive.
Yeah, it's so interesting. I remember just even researching TV screens and the flash rate. But what makes it so addictive?
Right. So, unfortunately, games, our scene changed after 2009 when a screen, touch screen comes to our field, like iPad, smartphone. That is really, really game changer. That was in a negative way. And what it does is actually for gaming, there are well-known psychologists involved. They are using it's called randomized rewards,
Yes.
and then basically they are incorporating gambling psychological feature so that human beings have to keep paying attention to it, even when they get bored. Brain is telling this is not fun anymore, but they can't get off the attention. That's how they set up in that way.
Interesting.
There's what's called microscopic rules in each gaming feature. So when they taking some action, click, like noise happen, or shining happen, or some action happens. That's the micro rewards happening, producing dopamine.
Interesting. And I was just thinking as you were saying that, like I said, my daughter plays some games on the computer, not a whole bunch. It's always been very well regulated, and she can also put it down and go do other things. And that's the way we would like to keep it. But it was interesting because there's all this like, hey, you can go so far, and then it gets really kind of hard and boring. But if you buy this thing for $9, now you can make it even more fun. And it's like even like the placement of the purchase suggestion.
Right. So it's all well developed as a marketing.
Yes.
Right? In the past, for example, reward only happens for like monetizing, only happen for good gamers, but not anymore. Many kids get rewards, for example, cryptocurrency or actual money, by just playing.
Oh my God.
And usually more competitive and a more multiplayer game is more addictive. Now they have a peer pressure. Or my team, I'm going to impact my team if I don't join. And they well developed. Again, it's in the bad way, in the marketing way.
It is unbelievable how well thought out it is. And I think pointing out that there are psychologists on these teams. And I think I had mentioned after your talk, like even like Jeff Siebert who I saw first in the Social Dilemma, who was a former exec at Twitter, is like, look, I know we made these to be addictive to people, so I don't let my family use it, but I got so addicted to the program that I knew that we made to be addicting that I locked myself in my own closet.
Right.
For hours a night after working on it all day long. And I'm like, the whole family just got kicked out just over this.
Right. Yeah, developers have insights. My practice in Bellevue, Washington, where like Amazon, Google, Microsoft there. So a lot of people I work with is actually working in the tech field. They do have awareness, and then more they know about it, actually they themselves don't use it.
Right.
But there's that case that actually they get hooked into themselves. But those families usually have awareness how dangerous this could be.
It's insane. There was something else that you mentioned that just like, again, I think everyone in the planet needs to know about, but is not only that they're accessing games on gaming consoles, but what else do they have access to?
Right. So that's another thing. It's really important to inform. The gaming console give access, free internet access without supervision. So basically they can go to porn. They can have access to porn or illegal activity or drug or communication with those drug dealers. Because a lot of parents have installed like a monitoring system, right?
Yeah.
They know how to bypass it, but when they go through like a gaming console, like including Nintendo Switch, looks like a benign, just small gaming console, right?
Yeah.
But they are setting to Switch, and they have access to internet freely.
So they have access to whatever they can get on the internet, but you don't have the blocker. So pornography, potentially drug dealing, and all that other. Although I found out you could order drugs on Instagram apparently too.
Right. Yeah, so that's a big issue, right? And I introduced a case in this conference. A kid was actually traumatized by watching porn at age 7 through Nintendo Switch, right? And that image just keep disrupting him from his learning. He was diagnosed as ADHD because he was just couldn't sit still, right? Because every time he tried to focus, the image comes, he has to shake off and walk away. Obviously, medication is not going to help.
Right.
He has severe side effect from medication. He just finally didn't know how to help.
It's wild, and it was like I remember being touched by that story because you're talking about a 7-year-old who was accidentally exposed. Like most 7-year-olds don't go, I'm going to go check out porn and purposely seeking it out right away. But then there's this kind of, I felt like you were describing. He felt shame from it, but he couldn't stop it at the same time.
Right. Yeah. Exactly. He knew what was wrong, but he was so sense of shame. And he couldn't share that with anybody.
I definitely want to talk about like what people can do and how they might be able to work on it. But This concept of randomized reward, though, can you just touch on that so that we can educate people what that really means? Because I think the gaming uses it really well for a negative, addictive way, but you can also use it positive. That's how we train our dog, right?
Right.
So you can train your children better this way, too, if you understand this a little bit more.
Right. So randomized rewards is basically, for example, they're going to do like positive thing, like a cleanup or studying, or they take a proactive measure. And then if there's always some rewards or always rewards comes after the good thing, then they get bored. They start expecting, if I clean, I get $5 or I get this treat. Then they stop engaging. So randomization of reward is, they don't know if the reward happens or not. The bottom line condition is they do some good work.
Yeah.
They may not receive the treats, but they have to do that in order to get the treat. So that will help them to keep engaging, right? They start thinking, hey, why I didn't get this reward this time, but I get it last time? To start to figure out, and so both happens when I do something positive to myself. Right? So that's how they, engage in the positive way.
Yeah, and I think it's great for parents, like, not to reward them every time, because otherwise your reward gets less valuable, which is why you have escalating requirements of rewards.
Exactly. And then they stop engaging.
And worse behavior.
Right.
Because they're not engaging.
Yeah. And never ever use gaming as a reward. This is very common. Well, if I get A's in this quarter or semester, I'll buy new gaming console or gaming, which is not good approach, because negatively reinforcing the behaviors.
Right. And then you wonder why, like, you gave them the gaming console and their grades went down. Because now they're addicted to the...
Yeah, exactly.
That's wild.
Yeah, and then this is, bottom line, this is this type of stuff, right? It's amount of dopamine produced from gaming is as same as was greater, possibly greater than cocaine or amphetamine. Studies showing that amount of dopamine produced every beat is almost same level or even possibly greater than those drug abuse.
Wow.
And the brain structure change, functional MRI is showing the gamer's brain structure altered in the same manner with substance addiction.
Yeah, again, this is one of those where you just want to restate what you just said. I mean, gamers that are addicted, their brains are actually changing in a way that looks like a drug addicted brain. And then also the amount of neurochemicals that are associated with drug addiction and high amounts of like dopamine are similar or greater with gaming than actual drugs themselves. Right. That's just, guys, that's insane. Okay. That's what these things are doing, which is probably why your kid's up all night and not paying attention to you at all when they're on their gaming console.
Yeah. Like, many people know, many parents know sugar is addictive, but it's not in comparison. For example, if you lock sugar, maybe they're going to, be upset, but they don't break into your room to get the sugar, right?
Right.
But they do. If parents hide a gaming console or stop Wi-Fi access, they will break it into literally.
Wow. Is there an okay way to use gaming?
I mean, that's tough. There's some people, it's the same as drinking, right? When people can balance it out with other activities, yes, it can be part of like fun activity. Yeah. However, comes with a huge risk. That's why a lot of kids or college students were well educated about potential risk of alcohol, right?
Yeah.
If you drink too much, that can impair their life and they become alcoholism. They have that awareness that this is not good for me, but I'm using it for fun, right?
Right.
But that part is missing for gaming. Look benign, right? Character is generally cute, and then right? And
or like huge and buff, like I wish I could be, right?
And it's legal, right? There's no age limit, which should change. I think in the future, if this activism is going well, right? I think there's a label when they purchase the video game, or there's potential harm.
Right. Yeah, and I think there's a bit of a challenge. There's so much money involved in gaming.
Right.
That there's going to be big pressures to not regulate. But are there things in the works? Are people actually addressing this?
Yes, school districts. At least in my local area, Seattle School District, suing the major social media company, and then those companies who know there's potential harm, but enable it.
Gotcha. So if someone thinks that their kid might have video game addiction or whatever, I mean, are there resources to help them, or like cheat sheets or websites they can go to really learn about it, to find out like, hey, this is like, if I've got 5 of these 7 things, or I've got 10 of these, whatever, any kind of resources?
Yeah. Right. So it will become in the United States officially diagnosable mental health condition in ICD-11. That's what we call.
Yep.
You know, so it's coming. You know, and then in 2022, WHO officially recognized this as an addiction.
Wow.
So it's a real thing. In the past, it was, some parents and patients themselves like deny, no, it's not real, but it is real.
For real, definitely. Yeah. And then, so what do people do? I mean, because like, I know a lot of people are just like, oh, let's just take it. Like, I mean, I think you went over, I'd really love for you to share a little bit about like your approach, because it was very, very well thought out, and one that I could see a lot of my people having a challenge with, but also being very successful at achieving.
Yeah. So main thing I want them to know, parents or patients themselves to know, or skill they impair is boundary skills. They decided I'm gonna play only 1 hour, but they'll play 1 hour and a half. If they set 2 hours limit, they're still gonna go beyond 2 hours and a half. Like not be able to follow the boundary or maintain the boundary. That applies to many things, planning or interpersonal or many ways. So just have awareness of that and guide them about the own limits or agreeable limits with family, and then you just follow it. Okay. So that's one way. And to do that, many of my patients who recover just keep voicing it. It is impossible to sit with gaming console and then not play. Therefore, what they do is fill out their schedule with extracurricular or reading book or playing guitar or something. Just fill out the schedule and then try to follow. Yeah. That way, they don't need to sit in the room by themselves with computer.
Yeah, I think that's part of the isolation, and we saw a lot of this get worse with COVID.
Yeah.
And you mentioned the inflection point at the iPad, 2009-ish. Definitely even more. What were those stats with to me, the biggest thing about the pandemic was the fact that they forced us to isolate, and then people who are in the same families and houses would end up isolating, and just the only thing these kids had were their computers. But what happened, like, with that additional isolation? Do we see massive shifts? Or?
Right. Yeah. So this is 2010 data, but average screen time for age 8 to 18 is 7.7 hours a day. It's not including school-related or work-related, which is a lot. But for now, age limit for 10 to 14-year-old range, pre-pandemic, they used about 3.7 hours a day of recreational use of the screen. After pandemic, it became 7.7 hours. And then now many restrictions gone, right? Loosen up. We have access to activities and everything. But somehow the excessive screen use, like 7.7 hours, it stayed elevated.
Oh my God.
It's not coming back down, right? And I really want parents and patients to think about you're going to spend like about 10 hours-ish for work-related school, right? 10 hours-ish to sleep, right? Now you're adding 8 hours of screen time. Adding up 28 hours, it doesn't make sense.
Yeah, like you were saying, like the whole day is just not even that long.
Right, and then that's not including time to exercise, socialize, doing hobbies, and any other part. No wonder they're part of the brain responsible for like exercise or communication, verbal speech, and facial recognition. They're impaired because basically that part of the brain is not used.
It's so interesting too, because when I talk a lot about polyvagal theory and how to get out of that flight, freeze state, and especially that freeze state, we have to recognize the cues of safety. But a lot of the cues are like facial, vocal intonation, facial expression, and things of that nature. And if you can't understand expressivity to know that you're safe, you're just going to stay doing the thing you were doing, which is more gaming.
Right. And often though, clinician can see exact root cause of why they're heavily addicted to gaming. For example, trauma, or some other family dysfunctional family situation, right? Yeah. However, when somebody's addicted, addiction treatment has to be first. Otherwise, root cause treatment is become less effective, sometimes ineffective at all.
So you're saying treat the gaming addiction first.
Right. It's seen as alcoholism, right? When somebody is heavily addicted, still drinking, come to the office for depression. Detox first. Same here. Detox first. And then it has severe withdrawal symptoms usually if they discontinue the game. You know. However, after 4 to 6 weeks, they will notice the difference.
So the kids will notice. And what I think I've took from your lecture is they'll continue to once they get out of the detox period, they'll choose to not go back.
Well, with right guidance.
Yeah, good call.
Yeah, because they'll usually now I got better, so next time I'll be careful, and then slowly using it, and then not following whatever their own boundary, then go back to their work. But when they experience the improvement, we can help them. Do you remember when you stop playing video games? We noticed this. You noticed too, right? And they say, yeah. How about now? Gone. What do you think this association will do between the change? They'll start with denial. No, this time was because I meant this, bad teacher.
Yeah.
Parents are bad.
Well, it sounds like a lot of addiction as the excuses come up.
Exactly, denial. So I inform them before we introduce. These are the signs and symptoms to look for. These are the signs, a common thing I hear for denial.
Yeah.
Right? And I'm not going to be here to take away. It's more like informing you about possible relapse. Right. Or coming back of the old behavior. So those things. And if somebody's heavily addicted, they choose to not go back to gaming anymore.
Right. Is it like drinking? Like if you are that heavily addicted, you go back once, you kind of like relapse.
Exactly same.
So it is like a full-on addiction. This is not like, we're not goofing around here. We're not making up new things. Like the World Health Organization and like the CDC and everybody are coming out and saying, and psychiatrists, that we're with the DSM. Do you know if it's going to be in the DSM? Because I know you said there's going to be an ICD-11.
It's already in the DSM.
Oh, wow.
The ICD-11 is a more newer edition.
Nice.
Yeah.
Well, and it's nice that people are recognizing this. Hopefully we will get those warnings and be able to do those things. So, any kind of like thoughts for parents if they're thinking this is a thing for their kid, where do they start or where do they reach out? Because it's great to know about this, but if we don't know how to take action.
Right. Let me tell you from the hard part. Okay. Parents start learning how to use it correctly or intentionally first. And then do that at the whole family. All right, that's hard, right? And again, I didn't share this concept here, but screen use is not coping skills. All right, how do you cope with stress? People say, watch Netflix. That's not coping; it's a distraction. Okay, it doesn't reduce the stress. It pauses the stress to come in more, but it doesn't reduce. Right? So what is healthy coping skills? Exercise, talking to someone, socializing, meditation, and those things, right? And as a family, parents can demonstrate that instead of every single moment checking the phone, right? Or making an excuse, this is important, but in the real, you're texting, messaging, and then actually watching social media. That's not good role model, right? And do that as a family. So that's a very important part. Be mindful about the use and be intentional about the use. And think about tracking how many hours they're on the platform.
Right. And all of our phones give us a report like every week of how much we've used, and I'm always like, so it's out there. And I think it's I love talking about, hey, we may not be able to start with our kid and get them directly doing something, but we can be the leader. We have to lead first because we have to model the behavior we want to see. So I'm so excited that you brought that up, because if you're on your phone, your kids know and love it, and they're like, well, if mom and dad are on it.
Yeah, it's a learned behavior, can be, right? But when family invite them to do it's the board game or just a family gathering, then keep starting saying, no, because I'm a teenager. That's not true. That's not. It can be a sign of already getting to the addiction state. Because when they treat it, they would love to come and connect with family and talk and enjoy. As long as family is kind of healthy in a normal environment, toxic environment, right? So those things is not because they're teenagers, because their mind is starting hooking into or getting negative influence from that, right? Even little things, hey, put the clothes away, they get so snappy. Yeah, that might be a sign of symptoms, right? All these signs. And those family went to residential care.
Mm-hmm.
They sold out these funds, but they really regret didn't take action out soon enough.
Right.
They thought this is just the age. They thought they're gonna grow out of that phase. They didn't.
Well, I see so many that, and I mean, I think it's heed the warning, like know that this is like addiction can happen and be triggered at any point, and everybody's a little bit different. But like, I'm also just thinking like engagement. Like if I'm decide to watch a show rather than have a conversation at dinner, it's a completely different dynamic the rest of the entire evening. And like so many people are, well, my kids won't do that. I'm like, that's what I love about our MAPS conference and like your presentation, because you're like, give them credit. Like, if we have the preconceived notion that they'll succeed and engage, then they more likely than not will. And so when we give them the opportunity to, but a lot of people are, they won't. So then you start doing this. I mean, again, it's like, give them the opportunity. And I think you had mentioned the other day something about boredom.
Yeah. So they will struggle with boredom. Okay.
As many of us do.
So when they don't play video game or they don't use screen, they'll say like, I'm bored, nothing to do, right? You remember when they're little, they can find any little look like nothing to create the joy, right?
Yes.
It's just from the floor, nothing, but they be creative and enjoy. So boredom stimulates creativity, actually increase more intelligence too, in that way. So that's a healthy coping skills that they're developing. They have skills, but they are lost because they are so reliant on the screen. But that will come back with the right guidance. Okay. So boredom is a good thing. But at the same time, if you leave it really too long, they'll struggle really bad, especially when you do screen fasting. Right. So give them some tools, like for example, could be Lego, could be drawing, could be music, instrument, family like board game time, right, stuff like that, to fill out the schedule. But boredom in general is really good thing.
I think it's one of the things I missed so much as I went through medical residency. In all my training, I'm like, oh my God, I don't have any time to be just bored. But I think it's important too and I think one of the things that can become challenging in this current day and age is parents fill their schedules up and then they're like, oh, I don't have any time. But again, I would challenge you because I don't have any time.
Yeah.
And then, or you're watching TV or you're binge watching or whatever, which is kind of an interesting term too. So it's about the family coming together. It's going to help everybody.
Absolutely. Any straightforward as anxiety, executive functioning, depression, anger, those things go down and the wellness scales go up, right?
Yeah.
So I shared a study during pandemic, pandemic fatigue. What was caused pandemic fatigue? Was it the lockdown? Was it isolation? Actually, that was excessive screen use. That's what this study is pointing.
Oh my God.
Because this study is done during the lockdown, when they reduce the social media use less than 30 minutes a day, that improves all scale of signs and symptoms of pandemic fatigue. I mean, they get so much psychologically better.
So all they did was, we didn't change the pandemic or the lockdown. We just minimized social to under 30 minutes and our energy went up.
Right. When the scale goes up, similar effect happens by just adding half and 30 minutes of exercise as well.
How about that?
How about reducing social media and add exercise? It's two things.
Yeah, I mean, then you get all your happy drugs, then you get your energy drugs, and then your kids who aren't sleeping because they're exercising now, they can actually sleep.
Yeah.
And then they're hungry, and their body craves nutritionally based food rather than garbage.
Yeah. Well, parents definitely, and you will encounter, they will say, well, no one play outside anymore, so I can't connect with my friends without gaming. Okay? That's not necessarily true. If somebody has already had negative signs and symptoms and struggle, do you still let them go? If somebody has issue with drinking, they're saying, oh, I need to connect with my body at the bar. Do you let them go? No, right? So those are the things. If somebody is using in a healthy way, yeah, it might be fine. But if they're already showing the signs and symptoms, this is not the approach.
Right.
And then all my patients say, actually, they can connect with friends without game.
But they didn't realize that until they did it.
Right. So it's more like a denial, trying to protect their habits, by creating a logical thinking. In the addiction field, we often say like, flexible mind is a relapse mind. Because we often justify, I don't have to do it today, I'll do it later. Well, yesterday I didn't play games, so today it's okay to do, that kind of stuff.
Yeah,
Just follow rigid boundary and a plan. That's the way to go.
Yeah, and it's interesting too, because I know with like, if you have wide boundaries and then you try to make them like this really quick, it's hard. And it's that slow funnel where people don't fight you. But in this case, we probably just need to move it in a lot of these cases to that and go through that 4 to 6 week detox period and not mess around, because our kids are that important.
Right. And then the family will see the value. A lot of like hyperactive kids get a lot calmer, okay, and starting asking more questions, trying to connect with you. Those things come up. Natural desire to connect with human beings come back.
Yep. I love it. Well, I want to say thank you for being here. I'd love to keep chatting about this. Hopefully we can do it again. I know that we're at the conference still, guys, which is why there's been some noise in the background. The crowd is coming for lunchtime. So I just want to say thank you so much for sharing, and I definitely want to have this conversation continue, because this is literally one of the most important things I've heard in a very, very long time, and I appreciate you just immediately being willing to hop on and do a quick recording so we can get this out and share it with everybody.
My pleasure. Thank you for having me.
Yeah. So I'll grab Koichi's information and make sure all the links to him and any great resources that are available on this topic are put in the show notes, because this is hopefully the first of several conversations on this, because this topic, like I said, is I see it in my house, and the possibilities and how management with the strategies you mentioned can make a huge difference. I see it in all my patients and everybody we know around us, so we can make a really big dent together on this. So
yeah, absolutely. Yeah, because we briefly mentioned about virtual octave, but we didn't have time to describe what that is. Yep. So I'm more than happy to come back and share my full presentation.
Let's do it. All right. Appreciate it so much.
Thank you for your time.
Well, hey, everybody. Thanks so much for joining me for this game-changing conversation today on the Lyme Insider podcast. And such gratitude to Dr. Koichi Tanji for taking the time out of the conference to share from his heart this game-changing, I have to stop doing these puns, right? But it's such a good thing. He's just so impressive because he leads with his heart and he shares information that's scientifically validated and clinically proven to work, right? And it's not about judgment here. This is about giving you the opportunity to know something new, to learn something that could make a difference in your own life, in your children's lives, and in your friends' lives. This is such a big deal, right? We have so much technology in our lives, and it's so amazing when we use it as a tool. But it's just like kind of like our monkey brain. When our brain takes over our essence and we get so, stuck by this analysis by paralysis by analysis, by overthinking and worrying about everything, we can't live our full passion. But if we can get out of our head and have our mind be a servant of our soul, of our spirit, same thing. This technology, when it works for us, it can be a brilliant lever to allow us to have all this new sort of flexibility to do things that we could never do before, that we could be organized. We can have an entertainment that we never had before, but we just have to figure out how to have that proper relationship. And I think the knowledge that this can be as addictive as heroin, as crack, as alcohol, as sex, as gambling is so important for us to understand. So again, I just want to say from the bottom of my heart, a big thank you for all of you for joining me, and also for Dr. Tanji for taking the time out to share this information. If you enjoy hearing information like this, if you want to hear these game-changing conversations where we're not just resting on our laurels, we're just not presenting information that agrees with someone's opinion, but we're having true discussions that move this field forward, that get the people who are changing the face of science, medical research, clinical, and really the emotional aspects of our lives, so that you can start living your life and have your healing be stimulated by living your passion and your dream, rather than putting life on hold and trying to wait till you're all better. Use your life, use your passion to move you forward, to stimulate that immune system, to improve detoxification, improve your mental outlook so that you can heal. That's what these conversations on the Lyme Insider are about. So if you're enjoying this, please hit the like and subscribe. And the other thing is, if you want to connect with Dr. Tanji, check out all his information in the description below. The other thing is, please let me know what you're thinking. Did we dive deep enough? Do we need to have Dr. Tanji back and have another conversation? Are there other people and other conversations you want to hear? I've got so many amazing guests lined up who want to share knowledge from their experience. And that's all it is. It's our research, it's our clinical work, it's our personal experience. And we want to put that out there so that then you can put it in the hopper and see how that fits into your life, or maybe share it with a friend who's in need of this amazing information. So again, like and subscribe. It helps us tremendously to get this message out. Hope you enjoyed today's episode, and I look forward to chatting with you in our next podcast.